I am absolutely delighted to have the opportunity to introduce our keynote speaker of the hour. I am the director of the Human Rights Department, Dr. Love Jones, and it always gives me so much joy to see us be able to come together for something as important as acknowledging, celebrating, and supporting women's equality. And how befitting is it that our focus for this year is health equity for women, which we've experienced disparity and continue to experience disparity for quite some time. And so it is an absolute pleasure to be able to introduce our speaker, Dr. Mary Jo Cagle, who is going to talk with us a little more about where we've been and how far we have to go in pursuing health equity for women. Mary Jo Cagle is the Chief Executive Officer at Cone Health. She is the first woman and the first physician to lead the multi-hospital Cone Health system, and she has been named one of modern healthcare's 10 women leaders to watch for 2021. Dr. Cagle previously served as Chief Operating Officer at Cone Health. Since joining the organization in 2011, Dr. Cagle has been instrumental in recognition for quality of care. She previously was Chief Medical Officer at Bon Secours St. Francis in Greenville, South Carolina, where she was physician partner at Greenville East Center for Women. Dr. Cagle received her medical degree from the University of Alabama School of Medicine in Birmingham and her bachelor's degree in biology from the University of Alabama, Tuscaloosa. She completed her residency in obstetrics and gynecology at the Greenville Hospital System in Greenville, South Carolina, and her Chief Medical Officer Fellowship through the Health Management Academy. Dr. Cagle is the 2022 recipient of the Nina Griggs Gunter Servant Leader Award from Trevecca Nazarene University. The honor recognizes those who provide leadership and influence. As a role model for women who are servant leaders, she received in 2022 the Athena Award from the Greensboro Chamber of Commerce. It is one of the organization's highest honors and is given to those who improve the quality of life for others and works for the advancement of women. Dr. Cagle was the National Association of Professional Women's 2013-2014 Woman of the Year and recipient. She was named to the Outstanding Women in Business list by the Triad Business Journal in 2014. She was the 2010 winner of the Lewis Blackman Award presented by South Carolina Hospital Association, promoting patient safety in South Carolina hospitals. There's so much to be said about the work that she has done, so without further ado, please give a warm welcome to Dr. Mary Jo Cagle.
Good morning, everyone. So I didn't do any of that work by myself. I did all of that work with teams of dedicated people who wanted to do something for their communities, for people who deserved good health care, and who believed in the power of teams and the power of women to do more. And that is something that I'm passionate about. And today I'm honored to be here with you to celebrate women's equality and the women's right to vote. 102 years ago today, August the 26th, 1920. Yeah. The Secretary of State, Bainbridge Colby, certified the 19th Amendment to the Constitution that gave women the right to vote. Imagine that. It took that long. But I'm thankful for that. And also in June of this year, we celebrated the 50th anniversary of Title IX. Yeah. That prohibited discrimination on the basis of sex in any educational programs or activities that received federal dollars. Title IX created equity for women in any educational program, any sports program, and I'm going to tell you, the right to vote and the ability to have equality in educational and sports programs changed my life, and I suspect it changed the lives of most of the women in this room. I certainly wouldn't be the woman I am today without those two things happening. It paved the way for me to be able to go to medical school. And it gave me the confidence playing on those softball teams and those volleyball teams. Gave me the confidence to know who I was and that I was capable to go toe-to-toe with anybody. I certainly was never going to be an Olympic athlete, right? I mean, I'm 5'3", 5'4" if I stand up really straight. But I'm not afraid to slide into base. I don't get worried about a skint knee. I can catch a line drive. I was a really good second baseman one time. And I know how to be a teammate, right? I know how to take coaching. It doesn't intimidate me when a coach gets in my face and yells at me because he wants the team and me to be better. Those things helped me and made me the confident, strong woman leader that I am today. So today as I talk, I want you to remember three things. So, they tell us, tell you what you're going to tell you, and then tell you, and then tell you again. So I'm going to tell you what I'm going to tell you. I'm going to talk to you about the people who made these things happen, the passion they had for making it happen, and the partnerships that are necessary to continue to make these things happen. So who are the wonderful people that helped give us the right to vote? Well, you know the names as well as I do. They were people like Susan B. Anthony, Elizabeth Cady Stanton, Sojourner Truth, Ida B. Wells. These women risked having rotten tomatoes thrown at them, being locked up in jail. They went on the stump for months at a time away from home, living in attic rooms, traveling all over this country in awful conditions, being on the stump, talking about a woman's right to vote, probably doing things that none of us can imagine having to do to make this happen for us. Something that they probably knew they weren't going to be able to realize the privilege of. They pushed the boundaries to make this happen. Not just for themselves, but for generations to come. And then I think about Title IX. I think those names are probably not as well remembered, but Representative Patsy Mink was the woman who made that bill work its way through Congress and developed allyships of the men in Congress to help get that through. Edith Sterrett Green is a woman who worked behind the scenes in education to convince Patsy Mink to bring it to the floor and write that house in Congress. Dr. Bernice Sadler was another great educational hero that saw this had to happen. In fact, she wasn't given tenure in many universities because she wasn't ladylike enough and came on too strong. God, I would have been sunk. Billie Jean King, I'm of the generation that remembers her tennis prowess, but she worked behind the scenes because she saw what could happen if women were given a chance at the collegiate level and at the high school level to have the same funding in athletics. And then that language, no discrimination on the basis of sex. Guess where that came from? This attorney that people didn't know much yet, her name was Ruth Bader Ginsburg. Yeah. She kind of went on to have quite a career, didn't she? Yeah, but she was working. It was quite a coalition of people that worked for a future that they saw that was possible for all of us and for our daughters and granddaughters. You see, folks, it takes people. It takes people with a vision and a thought for what's possible who refuse to give up to make things happen. And it doesn't just take people who we see as names in history book. It takes just common, ordinary people. So how did I get here? Well, I grew up in a little rural southern town in Alabama. A small little rural southern town. My mom was white, but my dad was of mixed race. My dad's background is white, African American, and Native American. And no one in my family had ever been a doctor. There were brick masons and preachers and school teachers. And one Sunday at church, a lady missionary showed up who was also a doctor, and she was getting ready to go to India as a doctor. Well, first of all, that she was a lady and a doctor was the most amazing thing to me that I'd ever seen. At that, I was 3 years old, and my eyes were this big, that a woman doctor was actually at my church. First of all, I didn't know women could be doctors, because in my little southern town, all the doctors were men. Not surprising, right? But she talked about that she'd been the only woman in her medical school, but that this is what she was supposed to do, and that this is what she was going to do. And I was just all ears. I was consumed by the story that she told. Shortly thereafter, I went for my little regular checkup to my family doctor, and his name was Dr. Cary Gwynn. And Dr. Gwynn was a tall man. Now that I'm adult, I know he really was tall. He was about 6'4", and in that long white coat, he looked about 10 feet tall to me. And I was, weighing and getting measured for height, all the things you do when you go for your doctor for your checkup when you're a kid. And I looked at him as he came by, and I said, Dr. Gwynn, I'm going to be a doctor when I grow up. And his nurse said, you mean a nurse? Now, thank God for good nurses. We need every one of them. But I said, with all the confidence that a 3-year-old can have, I'm going to be a doctor. And she said, no, you mean you're going to be a nurse. You guys, this was in 1962, so now y'all can do the math and figure out how old I am. And he picked me up and said, no, she said she wants to be a doctor. And Dr. Gwynn did my exam, and afterwards he said, so Mary Jo, do you really want to be a doctor? And I told him the story about hearing and meeting this lady doctor at my church. And he said, so Mary Jo, if you really want to be a doctor, here's what you need to do. He said, you need to have your mom get you a library card. And you need to learn how to read. And he said, every year when you come and see me, he said, we'll talk about what you need to do. And he said, you're going to have to study hard. You need to be the best student in your class when you go to school. So you need to start getting ready now. So we left, and I said, Mommy, let's go to the library. I need a library card. Bless my mother's heart. That's what she did. Good for Mom, right? Dr. Gwynn, every year, this was a little small town that in the local newspaper, they printed the honor roll. And when my name showed up in it, he would cut it out and send a note. You're doing the right thing. Good job. Keep at it. When I was valedictorian of my senior class, he cut that out. He said, you're on the right track. Keep at it. When I went to the University of Alabama and I made the dean's list, he would cut that out. You are doing exactly what you need to do. Keep it up. When the announcement came out that I had been accepted into medical school, he cut it out. Good for you. You made it. Now starts the hard work. He was right. He was a person in my life that made a difference. That made a difference. So when I talk about people, I'm saying that you, the librarians over there were librarians that when I wanted to go out of my age group and find books, they guided me, right? They recognized a little girl who was reading above her age level, right? And helped me. There were people along the way. We can all be those people, right? So I'd never heard at 3 years old that a woman could be a doctor. Today, more than 53% of medical school graduates are female. So in a little bit, when I start talking to you about health equity for women, that's important. That's important because I went into obstetrics and gynecology. Women's health is my passion. But you don't have to be in obstetrics and gynecology to be passionate about women's health. You have to have a lens on the world that sees women and sees the needs of women. And having more women in medicine changes that lens, just like it does for every other profession. So, it's more than just having people. It's having passionate people. People who care about the issues and understand the issues. So what are the issues? Well, let's talk historically what the issues have been for women. When we look at healthcare across history, and I won't take you to the beginning of time. We don't have all morning, do we? But let's just go back to the 19th century. In the 19th century, birth control was illegal. And when it became legal, then we had women could only get birth control if they had their husband's permission, which means if you didn't have a husband, you couldn't get birth control legally. And then a group of female physicians, which there weren't many, they were a rarity, and nurses, thank God for nurses, began to work together to try to lobby and change that. And talk about people who got arrested. That group of women were arrested multiple times because of the stand they took to try to make contraception available to women and to try to get that law changed. But that law, thankfully, did eventually get changed so that women could get contraception. But let's look at the opposite end of that spectrum. And it's a history that North Carolina knows all too well. Then we had the laws around forced sterilization, the eugenics boards and eugenic laws, where people were forced to be sterilized. We know that that happened right here in North Carolina all the way up into the 70s before those laws were overturned. And we know in North Carolina that happened disproportionately to women. 84% of the sterilizations that were done in forced sterilizations that were done in North Carolina happened to women, and disproportionately happened to women of color, to African American and Native American women. It's a disgrace and a shame, a stain. It didn't happen just in North Carolina. It happened all over the nation. But we were one of the last to stop the practice. Again, our reproductive rights, our agency being taken away by a law that was passed. So when we get to the recent Supreme Court decision, I'm an OBGYN, and I've taken care of a wide variety of women over the course of my career. In fact, I was in private practice for 17 years before I became in administration. I've taken care of women who fall all across the spectrum, politically and spiritually and religiously, on that issue. And so I have great respect for all of those opinions. And more than that, I know how difficult it is for women when they're faced with hard choices. But what I think is at the deep emotional reaction that we're seeing is that historically, women's personal agency on matters of their personal choices around reproduction have been taken away from them historically in this country and given over to someone else. And so, without a say in it by the women who are most deeply affected. And so there is a visceral reaction when, again, legally, someone says, we're going to tell you whether or not you have a choice in the matter. And so I would say, once again, we stand at a crossroads of who gets to decide for a woman what happens to your body. And that's a health equity issue. And that's why there's this visceral reaction, regardless of where you stand politically and where you stand religiously. And it's hard for people to talk about that without an emotional upheaval because of where it sits historically for us. The employees at Cone Health asked for me to make a statement about where Cone Health sits. And where I've said for us is we're committed to giving exceptional care to every woman. And that we, right now, based on North Carolina law, our patients are going to make decisions between them and their physician for their care. That's what we're doing at Cone Health. But that's not the only areas where I think there are inequities for women. The number one killer of women in this country is heart disease. It's heart disease. Historically, and it continues until today, heart disease is underdiagnosed in women. It tends to be recognized late in its progress in women. And there's a simple reason for that. Most research done on heart disease, overwhelmingly done on heart disease, in fact, 90% of the research done on heart disease has been done on men. Did you know that? 90%. So all of the studies, all of the treatments, all of the ways we recognize heart disease is based on studies on men. Now, there's a simple reason for that. It's because nobody wanted to do it with women because they were afraid they might get some woman who gets pregnant during the course of the study, and then the medicines or the treatments might hurt the pregnancy. In other words, they wanted to protect us. Protect us. We needed protecting, ladies. So I first want to say it was done with good intent, but with a certain kind of paternalism. And because of that, we don't have great data, not the deep, vast well of knowledge that we have on men in heart disease for women in heart disease. Now, I want to talk to you again about the passion part. We have a new generation of female cardiologists who are absolutely passionate about changing this. Yeah. We've got 3 of them at Cone Health right now who will absolutely blow you away if you get to talk to them. One of them is Dr. Tiffany Randolph, she says her goal is to eliminate hypertension in Guilford County, because if she says if she can eliminate hypertension, she can eliminate heart disease. Another is Dr. Cardi Taub, and Cardi, her goal, she says, is to increase the research of women in heart disease. In fact, she is really, her practice is geared toward women in heart disease, because her big recognition is that we've got to increase the body of knowledge about women and heart disease. And then we have another woman who's really looking at insulin, diabetes, and heart disease, and the impact that has on women. She lost her mom to diabetes and heart disease, and it has lit a passion in her about this. And so, I mean, I never get out of a meeting out of those 3 women without great new hope being raised. And they are symbolic of what's happening all over the nation. So that's what I'm talking about, that now that we've got a majority of women graduating from medical schools, you're just seeing this whole shift. And it's not just medical school, right? It's the researchers coming out. We're seeing it in pharma. With the research and medications, there's this whole shift to make certain we're including women. So heart disease. And if that's true in heart disease, it's also true in things like colon cancer, where, again, the research was overwhelmingly done with men, and we've got to now bring women into the research. When we also look at disparities, we look at disparities among families, right? So what happens among children with single moms in the household versus children with 2 parents in the household, and how moms get access if they're working 1 or 2 jobs, and when their children can get in for care? And how do we close that gap? Right? That's an access issue. So that brings us to partnerships. Some of these issues of inequity have to do around social determinants of health. And how we solve those kinds of problems have to be done with partnerships. I talked to some of you today about what we saw during the pandemic and the way we solved a lot of those problems with some great partnerships in the community. And I'm really excited because we're moving forward with continued partnerships post-pandemic to address the kinds of inequities that I talked about there. We're looking at partnering with the county around our Department of Innovation and doing designed areas with the city and the county, designed communities that look at resources that are available with the city and the county to say, how do we design communities where we can embed resources for folks who need better access? Because access to care is absolutely at the root cause of how we make healthier families, to help solve the transportation and cost problems. How do we make access to food a better problem? Talk about passion. We have a philanthropist family, Dr. Miguel and Denise Brito, Jamila Pender, I'm a fangirl of hers, worked with to help us start a food pantry at our Women's Center. We've worked with the county and with Sandhills to start our behavioral health urgent care, so families can get their family members in an urgent situation and not have to spend hours and sometimes days in the emergency room. Partnerships with companies who have foundations to help us meet these most urgent needs. So the question and the challenge I have for each of you is, how could you partner? How could you partner to help end some of these inequities? Some of these are big, hairy problems that have been around a long time, that are going to take us all working together to solve them. But, I believe that this is something together, doing it together, can make a difference if we sat down at the table and helped resolve. So I get asked this pretty regularly, what's the difference between female leadership style versus previous male CEO styles? I think maybe one of the big differences are women are pretty good at collaborating. We're pretty good at picking up the phone and saying, can you do this? I could bring this. It's kind of like a potluck dinner, What can you bring to the table that I can't bring? So that's what I would ask you. What can you bring to the table that I can't bring? How do we partner? Earlier today, I mentioned Sojourner Truth. Her story is one of the most inspiring stories that I've ever read. She had every reason to quit, to be disillusioned, and just to say, forget about it. She was born into slavery. She was brutally treated and handled by the man who said he owned her. And she ran away from slavery, took her youngest child with her. But she had an indomitable spirit. She's the first person to go to court first person of color to go to court against a white man and win her youngest son back out of slavery, because she said, and she was correct, he was sold illegally, and she won that court case and got her son back. I mean, unheard of. It had never been done before, and she was successful. And she joined Katie Stanton and all those women on because she believed women deserved the right to vote. Yeah, she joined those women. And she became a powerful speaker. There are many speeches. I don't know how many of you have read her speeches. There are many speeches. She went out on the stump, and wow, she was a powerful speaker. And traveled continuously on the stump, working for women's suffrage, human rights, and women's suffrage. I mean, to better this country that had not treated her well. But one of the things that she said has always motivated me in my work to increase the role of women on my teams or mentor young women. I love this saying, so I'm going to leave it with you. She said, I love this statement, if the first woman God ever made was strong enough to turn the world upside down, all alone, if the first woman God ever made was strong enough to turn the world upside down all alone, these women all together are strong enough to be able to turn it back right. Ladies, I believe that we together are strong enough, along with our male allies, thank y'all for being here this morning, to turn the world right side up if we determine with passion and partnership to work together. I am willing to work with you and to partner with you to turn the world right side up. Let's do it. What do you say? It's been a real honor to be here with you today. And it's really my pleasure now to introduce Council Member Mary Kay Avizator. Mary Kay, it's all yours.
Let's give her another round of applause. Wonderful and so timely. I'm always honored every year as the council liaison to the Commission on the Status of Women to be able to bring the call of action. Although I think Mary Jo Cagle did a pretty good job of that already. I am first going to take a picture of this room. And the reason is you are part of my call to action. So I'm going to do this side. And I'm going to do this side. Now, why did I do that? Because you are part of that people, passion, and partnership. And I'm going to add a few more to that. I'm going to add power, persistence, and pride. Those also go along. People say, oh, do you have your notes ready for the call to action? No, because I want to glean it from everything that the speaker said. So just remember, when she was 3 years young, 3 years old, she was influenced by that doctor and by the person who spoke to her church who was a female doctor. Think about that. That doctor could have said, no, honey, you need to find another career. You need to think about something else. You want to get married and have kids and all of those things. But no, that doctor, who was male, said, go for it. That, my friends, is power. When she got the library card, her mom did that. That is power. That opened up a whole world for her. And her mentor, the doctor, followed her all along the way. Think about how many young women, how many young people that you kind of follow along the way. And every once in a while you send them a card, you send them a note. I know many of you have done that for me in this room. I'm pointing at you, Willie. Several in the room. So we've done the power. We've got the power of the people. We've got the power of the room. We've got the power of women. So now let's go to the passion and the persistence. The nurses and advocates for birth control, for getting rid of forced sterilization. You know, they were knocked down so many times, but they kept going with persistence. About reproduction rights, about heart health, all of those things, which men have had for eons. And yes, I do know there are some men who are advocates in this room. We thank you very much. But, you know, women have kind of been on the back burner in all of these areas. So let's end with pride. Pride in who we are. Pride that we can have that power. Pride in what we can do. Pride in how we can lift up others. Pride in how we can collaborate with others. It's not about me. It's not about you. It's about, as Dr. Cagle said, who can bring something to the room. And you know, there are so many women who do not have any of this. They are the ones that we need to help lift up. Believe you me, we have the power. Thank you.
Again, good morning. This has been an absolutely wonderful occasion. Please, let's give our speaker another hand, Dr. Cagle. Under my breath, as she was on the way back to her seat, I simply said, I like her. And that means something in this day and time for people to say things that resonate with you in a way that really compel you to want to do something, to want to be a part of a movement forward. And so, Dr. Cagle, thank you for sharing from inception to now the way in which a whole system, an entire village, was necessary in order to see the kind of progress that we have seen by you being in leadership of Cone Health today. So thank you for sharing that. Believe it or not, I've been a health advocate since I was 7. I am 43. And that is because for those of you who are frequent flyers of the Women's Equality Day breakfast, you know that somehow my mother always makes a feature at the closing remarks. My mother has been chronically ill since I was 4 years old. And so literally, some of my earliest memories involve being at the hospital for long stints, for extensive procedures, etc. And you get a certain savvy after a while about what's supposed to happen, when pain medication's supposed to be administered, the rhythm, that you're supposed to beat someone's back to move pleurisy through their system so that they don't become congested and develop pneumonia. You learn when a doctor is talking too fast. I remember being 7 and asking a nurse to slow down so that I could understand what it was that she was saying. I remember reminding another nurse that she had come in with everything but my mother's pain medicine and that she needed it, and she really needed it right now. And so when you think about what it means to speak up when it comes to your health, as much as it pained me at times to observe my mother's agony, it also taught me something very early about making sure that I was listened to when it came to my health. And I think that what Dr. Cagle has said today gives us all the more empowerment, helps us to understand the almost innate inequity in the way in which healthcare is administered so that we remember to speak up when necessary. We've heard several stories in the last few years about mothers during childbirth who have had to speak up to save their own lives. We've heard stories of people saying, I think it was an article 3 weeks ago, a woman gained 40 pounds during menopause, and they said it's just natural. Within a week, she was having a procedure to remove fluid that literally drained up to 30 pounds off of her body. Now, if you're like me, I'm like, maybe I have fluid. Maybe I feel fluidy. Maybe I should get myself checked out. It's a miracle. No, but really, when you think about the fact that she said, no, I'm pretty sure I'm not eating that much that fast, and I need you to look deeper. This is what it's about, voice. And not only voice, but persistence. So I'm thankful that every woman in the room has been able to get the charge for being a voice of persistence. I'm thankful for our colleagues in the room, our counterparts, the men in the room. My husband is actually sitting at that table. Dear, wave your hand. Every time I ask him, did you make your appointment for the doctor? He said, did you make your appointment? He says, well, did you ask them about this? Well, did you tell them more about that? He doesn't allow any kind of lopsided engagement about our health being a priority. And for so many women in homes, your health becomes the very lowest priority as long as you're keeping the machine moving. And so it takes this kind of partnership, this kind of connectivity with whomever you reside, that they understand that health is a priority for everyone, not just some. And so I'm also thankful for social movements that influence care. I want to give a huge round of applause to the Commission on the Status of Women. Let's give them a hand. Because women in North Carolina are dying at a less frequent rate of breast cancers because of the work of this group historically pushing the breast density bill, where women with dense breasts would be notified that they would need a different kind of imaging in order to detect any abnormalities in their breasts. So whether it's your nucleus or those who are a part of a community system, it takes push. I'm also thankful for a city that uplifts the needs, the priorities of women. Recently, the Commission for the Status of Women circulated a Women of Greensboro survey. The data has come out, folks, and they are still putting it together in summary. But when I tell you, it is some of the most compelling information about how to push for better lives for women in Greensboro, to include health as one of the cornerstones of their work. I could not be more grateful. Again, thank you to the Commission for taking this work seriously, not only in action, but in deed. And I'm thankful to our City Council. We have a host of City Council representatives here. We have Councilwoman Hightower. We also have Councilwoman Dr. Goldie Wells. We have Councilwoman Thurm. And we also have Councilwoman Abuzawader. If you all would raise your hands or stand to be acknowledged, we really appreciate not only your value, but your presence. Because let's be real. we're still a predominant council that's got more estrogen on the dais than we do have testosterone. And that's saying something about this community and their faith and their belief in the work of women getting it done. Finally, thank you to the city manager's office for always allocating the resources necessary for the Human Rights Department to do the work that we do and to support our commissions. Thank you to the staff, the human rights staff. Thank you to Jody Stanley, who is currently our outreach and education coordinator. This doesn't happen by happenstance. It's a meticulous process. And Jody and the rest of the team are always committed. We have a new commission administrator, Liz Lennon, who has always, from the day that she walked in the door, been passionate about making sure that the work of the commission is properly uplifted and coordinated. And so thank you to Liz for her work. And ultimately, thank you. Because it's not about coming to eat breakfast. It's not about coming to sip coffee and see who's who. It is about looking to your left and your right and seeing people who value something beyond this breakfast. To show up at the breakfast is only evidence of the fact that you are in other parts of the community every single day doing what is necessary to make sure that women have the experience that they should have in this community. So with that in mind, thank you and give yourselves a hand for being present and being committed to the work beyond the breakfast. As the only thing standing between you and the rest of your day, I am going to bid you adieu and say to you thank you once again. Hope to see you next year, and tell someone about how amazing it was to reconnect with your colleagues in the community who do work for women. Thank you. You'll receive a QR code in the email to give feedback on the breakfast. Your feedback would be greatly appreciated so we can keep making it bigger and better.
Hey, she's just a girl and she's on fire, hotter than a fantasy, lonely like a highway. She's living in a world and it's on fire, filled with catastrophe, but she knows she can fly away. Oh, she's got both feet on the ground and she's burning it down. Oh, She's got her head in the clouds, and she's not backing down. This girl is on fire. This girl is on fire. She's walking on fire. This girl is on fire. Oh, she's got both feet on the ground, and she's burning it down. Oh, she's got her head in the clouds, and she